By 2025, AI is set to revolutionize patient monitoring, potentially reducing hospital readmission rates by 30%. This statistic from a McKinsey report emphasizes the urgent need for innovation in healthcare. Traditional monitoring systems often fail to capture the dynamic state of a patient's health, leading to critical delays in care. Lives hang in the balance, making AI developments a beacon of hope. Current practices rely on periodic checkups and manual assessments. Vital signs checked at intervals may miss sudden changes, leading to complications and increased hospital stays. AI transforms this landscape by analyzing vast amounts of real-time data from wearable devices, predicting health deteriorations before they occur. Devices like the Apple Watch and Fitbit monitor heart rate, oxygen saturation, and stress levels continuously, sending alerts to providers when anomalies are detected. Mount Sinai Hospital in Chicago uses AI tools to analyze this data, leading to a 20% decrease in emergency room visits. Remote monitoring allows timely interventions that can save lives. However, integrating AI into patient monitoring raises ethical concerns. Data privacy is paramount. As sensitive information is collected, the risk of breaches increases. Over-reliance on technology poses questions about safeguards and patient care. Balancing innovation with ethical standards is crucial. The future of AI in patient monitoring shapes patient experiences and enhances collaboration between patients and providers. Personalized healthcare tailored to individual needs offers transformative opportunities. As AI meets medicine, the journey towards a proactive healthcare system is just beginning. Predictive analytics, utilizing statistical algorithms and machine learning, is at the forefront of this transformation. Algorithms can analyze data from wearable devices in real time, identifying deviations from a patient's baseline. This continuous monitoring allows for proactive interventions. Fitbit has expanded its capabilities from fitness tracking to health monitoring, incorporating algorithms that detect signs of atrial fibrillation with a 98% sensitivity rate. Such precision could lead to timely interventions, reducing hospitalizations. Apple continues to enhance the Apple Watch with features to monitor heart rate variability and blood oxygen levels, prompting users to seek medical advice when necessary. These innovations shift healthcare towards prevention. AI-driven systems are also making strides in remote patient monitoring. Companies like Livongo provide continuous monitoring for chronic conditions, sending personalized feedback through apps. This approach empowers patients while providing critical data for healthcare providers. For instance, a diabetic patient can receive daily insights on their glucose levels, allowing them to make informed dietary choices and adjust their insulin intake accordingly. This personalized approach fosters a sense of ownership over one's health, which can be empowering. The implications extend beyond individual patients. AI integration can significantly reduce costs associated with late-stage interventions. A study published in the Journal of Medical Internet Research found that early detection of deteriorating health through AI can decrease hospitalization rates by 30%, highlighting the financial benefits of advanced technologies. This reduction in costs is crucial, especially in a healthcare landscape strained by rising expenses and increasing patient demands. The global market for AI in healthcare is expected to reach $45 billion by 2026, driven by demand for efficient solutions. As healthcare providers recognize the benefits of AI integration, the pace of innovation will accelerate. But this growth also means that new companies are emerging with innovative solutions, creating a highly competitive landscape. Established players and startups alike are racing to develop the most effective AI-driven tools. However, the competitive landscape grows crowded. Companies like Bioformis and Sense.ly are innovating with personalized care pathways and virtual health assistants, pushing the boundaries of technology. Bioformis, for example, employs AI to analyze patient data and provide real-time recommendations for personalized treatment plans. Sense.ly offers a virtual health assistant that engages patients through a mobile app, providing consistent support and feedback about their health journey. As we embrace these innovations, challenges remain. Data privacy concerns loom large, and accuracy must be validated to avoid biases. The journey towards fully realizing AI's potential in patient monitoring requires thoughtful navigation. History shows that technological advancements often outpace regulatory frameworks, leaving gaps in accountability. For instance, the introduction of electronic health records sparked debates about patient privacy that continue today. Ensuring that patients' data is protected while benefiting from AI innovations is a complex but essential task. Moreover, the integration of AI in healthcare settings is not merely a technical transition, it demands a cultural shift. Healthcare professionals must learn to trust and collaborate with AI systems. This collaboration is not about replacement. Rather, it is about augmenting human capabilities. Think of a situation in an emergency room where AI systems analyze incoming patient data, alerting staff to potential critical conditions before they even examine the patient. Such a scenario exemplifies the synergy that can occur when human expertise and AI technology intersect. The future of AI in patient monitoring is filled with promise. Imagine chronic illnesses managed seamlessly through continuous data streams, where patients receive tailored recommendations. This vision is not far-fetched. It is a tangible reality within our grasp. The road ahead beckons innovation that balances advancement with ethical considerations for a more efficient and equitable healthcare system. The implications of AI-driven patient monitoring transform not just healthcare, but various industries. Hospitals can anticipate patient needs with unprecedented accuracy. Imagine AI analyzing vital signs in real time to alert medical staff before complications arise, enhancing care quality. A scene unfolds in an ICU where nurses, supported by AI, can focus on direct patient care while receiving alerts about any critical changes, allowing them to respond swiftly and effectively. Insurance companies can leverage real-time data to create personalized plans, leading to fairer pricing models. For instance, a patient with a history of heart disease may receive a plan tailored specifically to their needs, based on continuous monitoring data, rather than a one-size-fits-all approach. In pharmaceuticals, AI insights can streamline drug development, identifying patient populations for specific treatments earlier in the process. By analyzing genetic data alongside health metrics, researchers can spot trends that lead to more successful clinical trials. Yet, this shift raises ethical questions about data usage, emphasizing the need for transparent practices to maintain patient trust. As patient monitoring becomes ubiquitous, ensuring ethical data collection and usage is essential. While AI can enhance monitoring, it is not infallible. False positives and negatives can result in unnecessary interventions or catastrophic outcomes. Striking a balance between AI capabilities and human oversight is crucial. Training professionals to work alongside AI rather than being replaced is key. This training may include understanding AI's limitations, such as contextual nuances that only human practitioners can discern. For example, while an AI may flag a heart rate anomaly, a healthcare professional's expertise is vital in interpreting whether it's a transient issue or a sign of something more serious. Looking forward, the questions surrounding AI and patient monitoring prompt deeper contemplation of the future of healthcare. In 5 years, we may see a shift towards patient-centered care, where individuals actively participate in their health journeys. Wearable technologies and mobile health applications could facilitate this engagement. Patients might routinely check their health metrics on user-friendly interfaces, making them active participants in their own wellness. However, challenges remain. Will professionals embrace this change? How will regulatory bodies adapt? The next 5 years will be pivotal in determining whether we can harness AI while upholding trust, equity, and compassion, the foundations of healthcare. The balancing act of innovation and ethics will define not only the trajectory of patient monitoring, but also the broader evolution of healthcare. As we stand at the precipice of this transformation, the responsibility to shape a future where technology enhances rather than compromises care rests on all stakeholders involved.